Friends, I am Dr. Indranil Bhattacharya and I would like to talk to you about a condition which is plaguing the population of the country for a reasonably long period of time after the second wave of COVID-19 infection. The condition is mucormycosis, which also goes by the popular name of black fungus infection. Mucormycosis is a potentially lethal fungal infection with mortality rates of up to 90 to 100%. The fungus attacks defenseless human beings who have very low immunity, especially after infections like COVID. The normal immune system is able to ward off the attacks of the fungus, which is present in the soil and in air also. But when a person has severely compromised immunity, he cannot resist the infection entering into his body. These fungal infections are therefore called opportunistic infections. They take advantage of the person's lower immune status. There are certain predisposing factors which lead to the mucormycosis infections. These can be divided into two classes. The first is certain conditions such as diabetes mellitus, blood cancers, cancers of other organs of the body, organ transplantation, and so on, and certain treatment modalities such as treatment with corticosteroids, immunosuppressive drugs, as well as oxygen supplementation. Recently, many patients suffering from COVID have been on oxygen for extended periods of time. Normally, when oxygen is administered to a patient, it is humidified. This simply means that the gas is passed through a container containing water. Now, if the water becomes stale, it can lead to the growth of microorganisms and fungi inside, which can eventually infect the individual receiving the oxygen. Therefore, the water should be sterile and the container and the tubings should be sterilized every day. Now, the commonest form of mucormycosis which has been affecting the people of our country is called rhino-orbitocerebral mucormycosis, which means that the nose, the orbit, the eye and the surrounding tissues as well as the brain are involved. Mucormycosis also infects the lung, in which case it is called pulmonary mucormycosis. A combination of rhino-orbitocerebral pulmonary mucormycosis is almost invariably fatal. Therefore, immediate attention to the patient, early diagnosis and early initiation of aggressive treatment is mandatory to help these patients recover from this severe infection. There are certain warning symptoms and signs which, if present, may lead to the conclusion of a person having mucormycosis. If a patient is found to have any of these so-called red flags by the relatives, the patient himself, or by the physicians, immediate investigation should be started to arrive at a proper diagnosis. The most common of these signs and symptoms are nasal stuffiness, discharge from the nose, which may often be blood-stained or black, or it may be mucopurulent or even purulent, frank pus may come. The pain around the nose, the eyes and the face, swelling of the face and the eyelids and the area surrounding the eyes, bleeding from the nose, sudden loss of vision in one or both eyes, sudden bulging forward of one or both the eyes, which we call proptosis, sudden drooping of the eyelids in one or both the eyes, double vision, which we call diplopia, paralysis of the muscles of the face leading to deviation of the mouth to one side, sudden loss of vision in one or both the eyes, as well as fever with convulsions in some cases. In case any of these features or even more than one feature is found or suspected in a patient who has already suffered from COVID, immediate attention should be given and the patient should immediately consult an ophthalmologist and an ENT surgeon. The diagnosis can be arrived at clinically by an endonasal biopsy or a nasal endoscopy, as well as an ophthalmological examination followed by contrast enhanced MRI scans, and finally histopathological and microbiological studies. It must be remembered that even a slight delay may lead to devastating consequences. Now the question arises, can mucormycosis be prevented? It may not be possible to prevent all cases of mucormycosis, but it may certainly be possible to reduce the incidence of the devastating condition. The most important things to be kept in mind are every patient going home after treatment for COVID-19, his relatives as well as acquaintances must be made aware of the warning signs we have already discussed. The second is there should be judicious use and supervised use of steroids. Steroids are life-saving drugs. They should not be feared. They have to be used in conditions and they often lead to resolution of certain disorders. But they should always be used under medical supervision and following the guidelines laid down by all the international and the national societies and bodies. Second is the judicious and supervised use of tocilizumab, which is used to control the cytokine storm following COVID-19 infection. Aggressive monitoring and control of diabetes is one of the most important factors in helping to control the incidence of mucormycosis. It must be kept in mind that diabetes has to be controlled at any cost. Each and every one of the patients I have personally encountered had diabetes. Strict asepsis must be followed while administering oxygen, especially at home. Many patients are kept at home and oxygen is administered to them by the family members or caregivers. They must make sure that the tubings and the bottle containing water must be sterilized every day. Personal and environmental hygiene is also very important. The patient should be kept in a clean room and his linen clothing must be aseptically cleaned every day. Betadine gargle has been found to be of some help in preventing the onset of mucormycosis in post-COVID patients. And finally, the most important thing is to ensure that the patient and his caregivers and relatives must wear a mask covering the nose and the mouth at all times. Thank you very much for your attention.